My name is Tommy Trevino. I'm a Substance Use Navigator at UC Davis Medical Center in Sacramento, California, and a Sun Mentor with the California Bridge program. The California Bridge model is based on 3 pillars. These 3 pillars comprise core elements that represent the ideal model for providing care to people who use drugs in acute care settings. Rapid evidence-based treatment. This means 24/7 access to evidence-based treatment in EDs. Culture of respect, where every patient receives treatment with dignity and authentic human interactions. Everyone is treated with respect regardless of their diagnosis or reason for ED visit. Sometimes people who use drugs feel shameful and embarrassed or are afraid to seek care because they feel like they're being judged. We want everybody to feel respected when they visit the emergency department. Connection to community and care. It's important to connect and outreach within communities to be able to connect patients with care, whatever issues are going on. Someone who uses drugs not only struggles with substance use, but often also struggles with mental health issues, physical issues, homelessness, or being hungry due to food insecurity. It's really important for Sons to be connected with the community to be able to provide these resources to patients and to be able to provide a warm handoff. Substance Use Navigators are the key to California Bridge program success. A Substance Use Navigator is someone who works acute hospital settings, such as the emergency department or other hospital departments whose sole focus is patients with substance use. Sons use expert approach, screening, brief intervention, and referral to treatment are specifically trained in motivational interviewing, approaching patients with substance use disorders, and linking them to ongoing care. Sons provide specialized community resources to help patients with their unique situations. Patients no longer have to worry about where they can get help with substance use. They can come to the emergency department. Substance Use Navigators can reduce ED visits by connecting the patient to the right resources for them. Patients' needs vary. Some may have housing needs, some may have psychological or medical needs. It's important to provide patients with the care they need. AOD stands for alcohol and other drugs. Sons provide patient education that is specific to each patient's situation. They educate patients on the dangers of substance use and teach harm reduction approaches. Sons are instrumental in helping patients understand a substance disorder diagnosis and what medications the doctors may have ordered. Sons assist patients in getting follow-up care by helping to navigate insurance barriers, transportation barriers, or other personal barriers to help patients successfully make it to the follow-up appointments. I want to share a story that really had a great impact on what I do. The patient was a 47-year-old man who was struggling with alcohol. When I first walked in the room, he was staring at his clothes on the chair in disbelief. When I asked him why, he shared that he couldn't believe they were his. He then told me how 2 years ago he had a good job, was married to a nurse, and had a 1-year-old son. That all changed when his son passed away due to an illness. A year later, his wife passed away due to a broken heart. He started drinking to cope, lost his job, and now 2 years later, he's in the emergency department with alcohol use disorder. I called a chaplain for a visit, and after the chaplain left, the patient said to me, "I now know why the Lord took my wife, because my little boy needed her more than I do." That was his turning point, the moment when someone who has been struggling with alcohol or drugs can decide to take the change. This was his time. I offered to connect him with a treatment facility to get the care he needed, and he accepted. Look for a turning point to help patients in their dark moments. ESPERT, Screening, Brief Intervention, and Referral to Treatment, is a tool for the medical community so nurses, medical doctors can connect with patients in a gentler way so patients don't feel put on the spot. This opens a door for a son to join the patient care team. Approach will vary depending on patient and based on personal experience. ESPERT works and reduces healthcare by connecting people to care so they don't repeat visit. Once determined what substance patient is using, apply one of these tools, audit for alcohol and DASH for drugs. The goal is to learn where a patient is in their use disorder. This knowledge helps the care team make appropriate recommendations for patient's current use, which may include inpatient, outpatient, or detox. Both tools are billable and can be reimbursed by insurance coverage. Many patients have a significant moment of personal reflection following these tools. This can sometimes create a wake-up moment when their substance use is reflected back to them. The process of referral may vary slightly from hospital to hospital, yet the goal is the same: link patients to care. 1. Patient seen by medical doctor or social worker. 2. Refer to SUN. Each hospital is different. Some may have warm handoff lists, some may utilize EMR flag. More informal approaches are when Pacific clinicians request SUN support. 3. SUN performs assessment. 4. Resources and education are offered. Treatment options are offered. It's important to meet patient where they are. Don't push them. 5. Coordinate plan. This may include referral for ongoing treatment and harm reduction techniques. Some patients may only accept harm reduction teaching. Whenever possible, utilize a warm handoff. Having an established relationship with outpatient clinics ensures patients have a landing spot after they leave the ED. Community resources and connections are important. Building community resources is vital. Go out into the community and determine options for patients. This could be federally qualified healthcare centers, detox programs, narcotic treatment programs, tribal health, sober living environments, room and boards, or shelters for housing, food banks, or local charitable organizations to combat food insecurity. Go into your community and build relationships. It's important to understand your patients and meet your patients where they're at. Different patients will have different needs. There are different use disorders, and each patient should receive individual care. Document each visit. Collect contact information to get a hold of the patient again. Note where the patient is referred to. Include a narrative capturing the patient's visit, what was shared, and what may be relevant should the patient return. Include a treatment plan and chart documentation. Knowing how many times the patient has visited the ED for substance use disorder is good to note. This is an opportunity for connection and reference point for future communications. Sometimes there are challenging cases. In this scenario, a chronic pain patient who was physically dependent on opiates for pain management came to the ED in withdrawal. His primary prescribing doctor stopped prescribing. While buprenorphine is often used for withdrawal, in this case, the patient was resumed on morphine and referred to outpatient for ongoing pain management. Bup for pain management is an option sometimes, but not every patient. It's important to consider each patient's situation and request consults from an addiction team, substance intervention team, or a knowledgeable medical doctor. There are common challenges when caring for people who use drugs. People are agitated and chronic pain, have mental illnesses or family dynamics complicating their lives. Some are high utilizers who are not necessarily in need of medical care, but often seek ED services for shelter, food, or other personal needs. Tips for dealing with challenging patients: be kind, keep a calm voice, introduce self as counselor to offer services, request entry to patient space and permission to engage with them, get to know the patient, build trust before addressing the issue. UC Davis in green shows the volume of patients served in an established MAT SUN program. The SUN program was in effect approximately 3 years prior to the statewide California Bridge rollout. As hospitals grow their programs, their patients served will increase as well. The longer the program is in effect, all these metrics increase. Opiate use disorders, patients identified, bup starts, bup prescriptions, and follow-up for MAT treatment, as seen here, increasing from April on the left to September on the right. Here are some of the SUN's teams throughout California. These dedicated individuals have had a profound impact on the lives of people who use drugs. These buttons and posters have been very successful in getting the word out about services offered at hospitals. Treatment starts here, and it starts when patients come in for help. Thank you for your time. Please visit our website, bridgetreatment.org, for more information. My email is listed if you have specific questions.